In this video, I want to talk about the relationship between breathing dysfunction and musculoskeletal dysfunction and how understanding this connection can help you manage your back pain. Hello and welcome to the Back Pain Guide. I'm Duncan, a former sufferer of debilitating back pain, now turned physiotherapist who focuses on the care and treatment of other people, perhaps like yourself, who also suffer from back pain. The advice I give is a mixture of my professional and personal experience, and I focus on trying to give information I wish I had known when I was suffering from back pain. So the relationship between breathing dysfunction and musculoskeletal dysfunction has garnered a fair amount of attention in recent years. So the process of breathing, which is often taken for granted as an automatic body function, does play a vital role in maintaining the stability and health of the musculoskeletal system. If breathing does become dysfunctional or even suboptimal, it can exacerbate or even be the catalyst for dysfunction in the musculoskeletal system, particularly around the lower back. In this video, I want to help you understand the relationship between breathing dysfunction and back pain, hopefully shedding some light on how dysfunction in one can lead to dysfunction in the other. I also want to offer some helpful advice on how you can use this information to help you manage your back pain. So breathing dysfunction in the context of musculoskeletal dysfunction refers to irregular or inefficient breathing patterns that can negatively affect the musculoskeletal system. So breathing dysfunction can manifest itself in several ways, and one we see in the clinic all the time is with shallow chest breathing. And this is when, instead of using the diaphragm for efficient inhalation, people with breathing dysfunction primarily rely on the muscles in the neck and chest to draw in air. And this shallow breathing pattern can lead to increased tension in various parts of the body, including the lumbar spine. Another manifestation of breathing dysfunction is inconsistent breathing rhythm. And if somebody is experiencing this, it can really mess with their ability to stabilize their spine through their core musculature. A final and very common manifestation of breathing dysfunction is breath holding. We see this all the time, often when giving people new exercises to try in their rehabilitation. Holding one's breath, of course, can lead to increased musculoskeletal tension, which can exacerbate symptoms, including pain. So the link between breathing dysfunction and back pain lies in the reality that the respiratory muscles, the muscles that cause breathing, and the muscles that support and coordinate the spine are closely interconnected. It's really important to note that this is a bi-directional relationship. So breathing dysfunction can impact musculoskeletal dysfunction, and vice versa. Musculoskeletal dysfunction can impact breathing dysfunction. So these things tend to get worse together, or fortunately, they can get better together. If breathing becomes dysfunctional, it can affect back pain in multiple ways. The first is with postural changes. Now, there's a lot of debate about posture in the physiotherapy world at the moment, and I personally do subscribe to the notion that there is no one perfect posture. However, it's clear to me that sometimes people are doing things posturally that are impacting their back pain symptoms. So for example, if somebody is manifesting their breathing dysfunction with shallow chest breathing rather than efficient diaphragmatic breathing, this can lead to excess tension in the neck and upper back muscles, leading to discomfort and pain in that area. It can also lead to excess tension in the lower back, the lumbar spine, leading to an inability to relax the lumbar spine in non-weighted or supported positions, like when lying on your back, which can lead to a buildup of tension in the lower back, often causing or exacerbating pain in that area. The second issue we see a lot in clinic is a lack of core stability, and efficient and proper breathing actually helps to support core stability. And when the diaphragm functions optimally, it acts as a stabilizer for the lumbar spine. So dysfunction in diaphragmatic breathing can actually compromise core stability, potentially contributing to lower back pain and symptoms. And last but certainly not least, stress and tension. So dysfunctional breathing, particularly that shallow chest breathing, can absolutely contribute to stress, anxiety, and even trigger the release of stress hormones. This can increase muscular tension and inflammation, potentially exacerbating back pain symptoms. Addressing breathing dysfunction in the context of back pain involves interventions aimed at restoring optimal breathing pattern. So how can you, as a back pain sufferer, gain these benefits? The first place I would go to is with encouraging diaphragmatic breathing. By improving your diaphragmatic breathing, you can also improve your core or spinal stability and help reduce muscular tension in the area. If you're interested in trying to do this, I have exercise tutorials for improving your diaphragmatic breathing in the Exercises for Lower Back Pain playlist on my YouTube channel. I would also invite you to consider the stress management benefits of focusing on improving your breathing mechanics. Addressing stress and anxiety through breath control techniques like deep breathing or meditation can help reduce the release of stress hormones and minimize their impact on your musculoskeletal health and your back pain. If this is something that perhaps interests you, I have various videos on the YouTube channel that are guided meditations focusing on breathing mechanics specifically for people who suffer from back pain. Recognizing the interplay between back pain and breathing dysfunction can be a crucial step to help sufferers of back pain overcome their condition. By addressing any potential breathing dysfunction you may be experiencing, you can give yourself the best possible chance for the best outcome in your rehabilitation. I hope you found that information useful. Remember, you have the power to take control and move towards a pain-free life. If you enjoyed the video, please give it a like and consider subscribing to the Back Pain Guide for future videos and more valuable content. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to guide and support you on your journey to recovery. Thanks again for watching, and I'll see you in the next video.